Hello, I'm Dr. Chow of MINA Plastic Surgery. Today we'll be talking about rhinoplasty. We can classify the materials that we use for rhinoplasty into two categories. One is for the augmentation in the bridge area, and another one is for the structural support in the nose area. Let's start with the augmentation part. For the augmentation part, the most commonly used and my favorite materials that I use is the silicone implant. There are other materials such as Gore-Tex or any other synthetic materials, but I prefer the silicone implants because they have far less side effects. For structural supports, I almost always use a person's own cartilages, which is located inside your nose. And of course, ear cartilages are also very commonly used. Now, in some cases, when some people, by any reasons, we can't use the septal cartilage or ear cartilages, then we would harvest the rib cartilage for the structural support. Obviously, after the surgery, you have to be very careful so that the wounds heal very well and nothing goes wrong. To ensure that what we urge people to do is don't get the operation site wet. If it gets too wet, then there's a possibility of infections going up. Also, we'll have the splints on the dorsum area of the nose and packings inside your nose. Don't touch that. Leave that where it is. And the most important thing, I always stress this: don't smoke. No smoking, no drinking, but in my experience, smoking is by far the worst things that you can do. The incision will be done in the middle of the columella area here and then extended inside your nostrils. This is a process called open rhinoplasty. I always do open rhinoplasty because we can utilize lots of materials on the inside and we can actually change and do the surgeries correctly. In comparison, if we were to do closed rhinoplasty where we only make the incision just a little bit inside the nostrils, there's a limitation of the utilization of the cartilages on the tip, and we can't really make it perfect. After nose job, a lot of people say that they have runny nose. Now that is pretty common because after we do the surgeries, there are some of the swellings and irritations to the mucosal membranes on the inside of your nasal cavity. Now if they are swollen, then some of the secretions may increase, which will result in rhinorrhea. Alar reduction is necessary in some people with very thick skin or people with large nostrils. People with just a little flaring, we really don't need to do alar reductions. But in case that we do the alar reductions, now the scars, they may appear if it's not done properly. Now there is a technique to hide the scars and minimize the scars. And if you look at the junction between the nostrils and the cheek area, there is a groove where it meets. Now, there are certain places where it scars the most, and just right next to it, it doesn't scar that much. And if we were to do it correctly, there hasn't been a scar issue. A lot of people ask that if we do the augmentation to the nose, would their distance between the eyes get a little bit closer together? Many people think that is true because they look at their mirrors and they simulate the augmentation of their nose. But if you look at the part where people are grabbing here, they're not actually grabbing the part where the implant would be, but grabbing the tissues adjacent to the place where the implant would be, which is very closer to the eye areas. Now the soft tissues are very firmly attached to the bony areas. So just because we make a pocket here and insert an implant here or augment anything here has no effect on the adjacent tissues. So my answer is no. The distance does not change. After receiving filler treatments to the nose area, you can do the rhinoplasty because we can absorb the fillers, and even after absorbing it, if the filler particles are remaining, we can take it out. However, it is not a very good idea to inject multiple times of fillers, because fillers are foreign body, and those foreign body reactions can occur inside the tissues, which may complicate things. So 1 or 2 times like previous C fillers, that, well, it is operable, but I don't really recommend that you do multiple times of filler treatment to the nose area. We have a saying that the tip is maintained by the balance of tripod here, from the columella and both sides from the upper part. It is very carefully balanced so that it's straight. Now, if you blow your nose very strongly, what can happen is you can distort that balance of power, which may lead to a deviation of the nose. So please do not try to blow your nose too much. And another thing is, with the surgery itself, inside the nostrils, in the nasal cavity, the mucosal membrane are very swollen and very weak. And if you blow it too hard, then you may cause some damage to the mucosal membrane tissues. And nose bleedings can occur repetitively if you do that. So try not to blow your nose too hard in the early phase of the recovery period. You can use many different types of cartilages for the rhinoplasty. The septal cartilage, which is located inside your nose, the ear cartilage, and maybe perhaps the rib cartilage. Now, there are also all pros and cons. They're all good materials, but there are pros and cons with each cartilage. Now, the septal cartilage on the inside actually acts as a pillar of the nose. So if we harvest that cartilage, the strength is roughly the same. So it is a very good material for the strut or the structural integrity of the nose area. It's pretty strong, but the minus part would be there's a chance that it's too much deviated so that we can't use the enough amount. Anyway, now the ear cartilage is probably one of the most commonly used cartilage here in Korea, and maybe in other places as well. And now if you touch the ear cartilage, it's very soft. It's a very good material for the top area. If we were to augment on the top area here, it's very soft and it feels very natural. So it is a very good material for the tip, but the thing is, the ear cartilage is too soft. So if the ear cartilage are the sole material for the structural integrity, there's a chance that your nose may drop a little bit. Now with the rib cartilage, it is very strong. It's located in the paramedian area of your rib cage here. So we harvest a little bit there. Now rib cartilages are very strong, so I don't really use it for primary purposes, but in some contracted cases where we need very strong structural integrity so that it can support the contracted nose from going back to what it was before. Now, because it is very strong, you may feel a little too fake. Very rigid tip with the rib cartilage is used alone, so that is why we don't use. And also, there will be some scarrings along the donor site, and there are some post-operative pains after the surgical procedures. Those are the reasons that I don't use it for primary purposes. Now, whatever surgeries that you receive, it'll take at least 6 months for it to complete and settle down. Now, 1 week after the surgical procedures, we are going to remove the splints. Now, after you remove the splint, you're going to feel that it's pretty high, a lot higher than you expected. Some people may even look like avatars, very high. Now, that's because of swellings here. Now, swellings in the bridge area here usually takes about, on average, 3 to 4 weeks for it to go down. Now, on the side bone area, in case that we did some of the osteotomies to reduce or make the bones come out, whichever the case, it would take about 2 to 3 months for it to completely settle down. Now, the longest part for it to recover would be the tip and the supratip area here. Now, if you touch the skin here in the bridge area here and the lower part here, you can feel that the skin in the lower part is very thick. That means that remnant swelling is going to last a very long time. That is why we say it's going to take at least 6 months for it to completely settle down, because the tip takes at least 6 months for it to completely settle down. So what a lot of people say that in about 3 to 4 months, everything looks great except for the tip. They just want a little bit more. They just wish that the tip would be a little bit sharper than right now, but it's okay, it's fine. It's a normal thing because it takes some time for the tip to completely settle down. Okay, we talked about rhinoplasty as a whole. Now, if you have any questions or comments, please let me know at the comments below. Thank you for watching us. This was Dr. Chow, MINA Plastic Surgery.